I want to ask you about time management.
What
Right.
is most important? What's going to get me to my goal? And how am I going to get there? And if you're in a role of leadership, is making sure, am I delegating or am I just taking everything on myself?
Wow, that's so important.
Welcome to Straight Talk with Dr. Erik.
Hi everyone, welcome back to Straight Talk with Dr. Erik. And on today's episode, I have with us Jody Long. Jody, welcome to the show.
Thank you. Thanks for having me here today.
Jody, you know, the whole point of this show is for people to really learn about our guests. And the guests that we have, they do some incredible stuff. And I know a little bit about your background, but the audience doesn't.
Sure.
Tell us a little bit about yourself.
Sure. So my name is Jody Long. I am a nurse by background. I have been in nursing since 1997. So I always like to tell everybody I started when I was 10.
Wow, right.
But I have always loved the world of healthcare. I actually didn't start out as thinking I wanted to be a nurse. I know a lot of people say nursing is a calling. To me,
That's what I hear most people say.
yeah, it wasn't a calling. I actually wanted to be a physician. I wanted to be an orthopedic surgeon.
Wow.
And had high hopes for that. And when I was 16, we had an event in my family that required me to stay home and take care of my dad. So I wasn't able to go away to college, and I just chose a track where I could still be in healthcare, and hopefully with the choice to transition into medicine after that. I got into nursing. I started out as a CNA, LPN, and then I fell in love with nursing. I knew that that was where I wanted to be because I had a greater impact on patients, and I had the ability to really start making changes that I wanted to change. So I went to RN school and started my career in the hospital at acute setting. Most of my career has been in the emergency department. I served about 17 years in the emergency department, worked my way up there, but did work inpatient and cath lab and med surg as well. So had a round, vast background before I dove into the ED. From there, I worked my way up into management and leadership, and then the healthcare administration part of it throughout a large health system. And in 2020, transitioned to healthcare tech. At that point, it was a choice that I made for myself and for my peers as nurses, is how can I give back more? And so I transitioned to healthcare tech, worked for Point Click Care for many years, and am now working as a VP of Clinical Operations at MindCare Solutions.
At MindCare Solutions. So tell us a little bit about what kind of work backwards. So what is MindCare Solutions?
So MindCare Solutions is a behavioral health company. We deliver services, or a comprehensive behavioral health solution that delivers psychiatric services into 3 different arms of business. So we see acute care, long-term care, and corrections.
Is this like a telemedicine?
We do tele and in person as well. So it depends on what our clients need. We can give them any type of end-to-end solution, or we can fill the gaps where they need, but it's psychiatry and behavioral health.
And it's a technology solution.
It
It's
is.
not a clinical service per se.
Right.
You are providing that technology to providers who are using your technology?
We do both.
You do
So
both.
we have both of those pieces. We're coordinating the care through technology and using technology services. Some of them are different virtual health platforms. We also are starting to build things out with Microsoft as well, using their tools of how can we deliver care better. And then we also have the providers who are delivering the service, and we use using our tools and helping us build better technology, data collection, and pieces like that.
And are those providers working for your company, or
Yes,
they're
sir.
working for their own?
No, they work for us. Yeah, they're employed, contracted or employed, or they're PRN, but they do work for us under that service.
Interesting. And so you started that role recently in September.
Yeah.
And I'm looking at your LinkedIn profile. What's interesting about the LinkedIn profile of Jody is, you could tell a lot by how long someone stays at certain positions. And I'm looking at your positions, and you're staying like in Manatee Memorial Hospital. You were there for 16 years,
Yeah.
right? Your roles before that, 4 years, 6 years. It shows the longevity. Yeah. So I can understand kind of now why, if I was the CEO of MindCare Solutions, why would I want you to come in as the vice president of clinical operations? Because I need someone who I can depend on.
Right.
I need someone who I can
Agreed.
trust. And
Agreed.
how do I know I can trust you? Consistency over time and looking
Correct.
at your. So when you were brought in as the vice president of clinical operations, what was the role? What was the objective? What was the goal that they set out for you?
So our organization is growing and getting larger. We are opening up different business lines of business, and having the background that I have of understanding the acute side of the business, long-term care side of the business, and tech. Really coming in and saying, how can we optimize our efficiencies? How can we optimize how our physicians are delivering care? And so being able to work alongside, the executive team and say, we need to either deprecate this solution and let's go into a couple, instead of 10, let's go into one. They're also an organization that has multiple mergers together. So now how do we get all of these other small companies to work as one? So it's a lot of, operations. It's a lot of like putting together SOPs and processes. And it's really, but having that clinical lens to be able to say, this will help with our providers, this will help with our workflow, and we'll still get the information and the data that we need to be able to present back our outcomes.
Yeah, I mean, that sounds like a very, very important role. And there's always a lot of noise that is, you have so many different moving parts. How do you, when you sit down and you have all these different moving parts, you have providers that work for the organizations, you have these other mergers that are coming on together, you have the technology piece that you have to put in together. How do you differentiate the noise from the signal of what you need to do?
I guess that's what's really good about being a nurse, right? We are taught how to triage, and you look at something from a bigger picture, and then you have to start figuring out what is my top priority, and then who does that affect, right? And so able to look at this from a bigger 30,000 foot view, and then start to hone in on really what needs to be changed first, because it's a domino effect, right? Like I can't change this process or platform without addressing this over here. And so, having that ability to know how it's going to affect the end users and the clinical end users, and then our clients as well, understanding all of that piece, I can then roll that into the kind of that triage process and then say, what do we need to focus on first? Even though you can probably focus on 100 things at one time.
That's the very hard part. Like myself being an entrepreneur, I know that I get very excited about an objective.
Correct.
And then I do one thing and I'm like, oh, you know what else would be really cool to add?
Yeah.
This other thing would be really cool. And what else? This. And then you're talking to your team and there's this overwhelming where they're looking at you with a smile initially. And then you could see slowly but surely they're getting overwhelmed. And you're the only excited guy in the room.
Yeah.
So how do you stay focused on what's important?
It's looking at the end goal, right? For me, knowing what's important is that the patients receive the best care and outcomes, and that our providers and our clinicians have the right tools to be able to deliver that. And so every decision that I'm making of prioritizing is, how is this going to affect a patient and a provider? And for that, it helps me stay focused, because ultimately that's my job in operations, is to make sure that people have the tools they need to do their job, and that we're delivering the care that we say that we're going to deliver. And I use that as my kind of grounding base, right? And what do I need to do to remove all that noise to make sure, are we focused on the right thing, and being okay to say to an executive team, I think we're going down the wrong path here. And, also to your point, recognizing when people are overwhelmed, right? There's this, and when everyone's accountable, nobody's accountable, right? So looking at directing that objective and saying, okay, well, we need to do this, and assigning those roles, and then making sure people who are overwhelmed that it's okay. We're all here together. It's going to be chaotic, understanding the chaos, identifying it, and then working through it. If you don't resolve the elephant in the room, it's not going to ever help you as you're moving forward. So
that makes sense. That makes sense. I mean, thinking about mental health and thinking about technology, what makes your company different? And that, look, I'm going to break it down very simple. I'm thinking, okay, you have someone who needs a mental health visit, a talk visit, talk therapy. They have a platform such as Doximity or Doxy. They log on to it, and then there are providers who are linked to it via either ZocDoc or Clinical Psychology Today or one of those resources. How are you differentiating the experience for all the end users, providers, patients, and everyone in the mix?
So one of the ways that we do that is really making sure that we are not the standard doc in the box, right? We want to make sure that our clients and our patients know that we're there for that collaboration as well. So for the experience part of it is, there are these type of deserts where there's no psychiatry available, there's no psychology available. And how do we get into those areas and provide access to care? We know that's a social determinant of health, right? So looking at those pieces and making sure, how do we address that? And then working with our clients by saying, you might have this service available, but is it an end-to-end service? Do you need call coverage? Like what happens in the middle of the night if you have a psychiatrist who's only on staff 8 to 5? So making sure that we have the ability to service our clients and give them the tools and the solutions they need, but also that the patients have access to care in a way that they're now not having to wait 24 hours for somebody to come back and see them if they're in a crisis.
Got it. And we're going to cut here for a sec.
Okay.
Very good.
It just
Off, but that's good. Okay. So that's very good. That's exactly what. Let me just pull you up over here and we'll continue. Perfect. 1, 2, 3, go. So that's very, very interesting. And the work that you're doing with MindCare. Mental health is a very, very important aspect of healthcare. And so it's incredible. I commend you for that work.
Thank you.
When you're thinking about shifting from the clinical world to the technology world, right? And I see that your path, you had I'm looking again at your career, and I'm looking at, you had your BSN, your RN, and also you're involved in a lot of technology. How is that shift?
It wasn't easy. It was definitely something that I had to do a lot of internal reflection and figuring out how I could make an impact. And it's why I just talked to one of my former employees earlier today about this. She wants to know, how do I make the transition? And I was able to, just tell her, you have to figure out what your drive is. What is your passion?
The why.
And then you start going down that path. For me, when I was working in the emergency department as a director, it was a large ED. We saw over 100,000 patients a year. I loved my job. I loved having people that I could lead and mentor, and I could see almost instant gratification of patients getting the care that they need. But to me, I felt that there was something more. I saw nurses and providers struggling with, these clunky EHRs and having to use technology that didn't really make sense to them. We're clinicians, we're not technology experts. And how do I now transition from helping patients and families to helping my peers to be able to deliver care in a better way? And so that was, after all that reflection, I said, I think I want to go into technology and make a difference there. I want my voice heard. I need nurses' voices heard. Physicians' voices need to be heard. And I dove in, and it was a huge learning curve for me. I have my MSN in informatics, so I had a little bit of background of some of the verbiage, but moving from bedside to technology, it is a whole different world. I had to understand for myself that I was sometimes the only person in the room that was advocating for a profession of, a million nurses, right? And I had to learn that voice. And how do I now translate this? I felt like a mediator a lot of the times, right? How do I translate this for them to understand that this is, either not the correct way, or this workflow is going to not work for them, and now what happens is a workaround, right? And that's where patient harm comes into place, because we've given them a solution that doesn't work, doesn't make sense, it's not within our workflow, so I'm just not going to use it. I'm going to do a workaround, and something bad can happen to a patient. And so that was really hard. I had to also, make sure that I stepped outside. We talk about this with my mentee through HIMSS, is stepping outside of my comfort zone. I had to push myself into ways and learn things that I didn't think I would ever have to learn as a nurse, but I needed to be able to have that credibility and the reliability to have those conversations and make sure that people understood, this is a legit problem and we need to take care of it.
Yeah, that makes sense to me, especially your background is very, very interesting. Jody's background is you are an RN. Mm-hmm. You've worked in the emergency room, which means that you're able to handle stress, right? Mm-hmm. The emergency room is not an outpatient, kind of, not to take away from outpatient, but it's a very high stress, high pace. And I remember when I was a resident, I loved the ER because the days fly by, the hours fly, you don't even know it. So you were kind of primed through your career to be able to handle that stress. So that's one. Then what's interesting about Jody is that you have an MBA, which is a very different view as well. Yes. So you got the clinical, you got the ability to handle the stress, you got that MSN from a technology perspective, and now you also have the MBA where you're understanding the whole ecosystem from a financial perspective. Tell us a little bit of why did you decide to go into the MBA? That's also very different than being an RN. It's a completely different world.
I chose to go on for my MBA for one reason. I am one of those people who, if I don't understand it, I'm going to throw everything into it. And working as a director of an emergency department, having to handle, a multi-million-dollar budget, handling productivity and staffing, sitting in a large room with board members and executives, I wanted to make sure that I understood, if I'm asking for budget for new equipment, how does that impact further down the line? And how do I have those conversations and talk about ROI and talk about how this is going to, do a business proposal and business plans? So that was something I chose to do for myself at the time, is I wanted to be able to be, again, a credible person sitting in that room and being able to have those conversations. And not that I want to be like an imposter syndrome or use certain kinds of words all the time, but it does add value to your conversations if they know, okay, I don't have to sit here and explain too much, but we can go ahead and have this conversation. And two, she also understands how it's going to impact down the line. I think sometimes in nursing, we are very focused, at the bedside of like taking care of these 5, 6, sometimes 7 patients that are in front of us, right? We are thinking of all the things that we need, and we get frustrated because we don't understand the business side of it. And so I really wanted to make sure I understood the business side, especially leading a large team. I can go back and tell them the why.
That's so important to understand the business side. I remember I was at an event once, and I think it was a ACHE event, and I'm sitting there, and I got up, and I see a gentleman. I come up to him, and I start speaking. Hey, how are you? I'm like, I'm Dr. Erik. What's your name? He's like, so-and-so. I said, what do you do? He's like, and it was this in a hospital. He's like, I'm the CEO of this whole hospital. I think it was Baptist Health downtown. and we were having, I'm like, oh, very nice. Right? And so we were speaking, and he got up to give a keynote, and he said, no margin, no mission. Which is very interesting, right? Because a lot of people, they say, we have a mission, we're going to do all this at all costs. But the truth of the matter is, if a business doesn't have a margin to sustain itself, to reinvest into its business, to reinvest into its team members, into specific initiatives, you don't have a mission.
Correct.
And so understanding that MBA, understanding those unit economics, the finances, the marketing, the sales, the value stream, the value proposition, those are all super, super important. And so I agree with you. I commend you on that. Looking at you, to be honest, it's like, this is an individual who has an incredible drive. And I could see it, right? Like, think about it. No, but honestly, think about it. You're working in an ER initially. Then you're the director of an ER. That means you have responsibilities. With each step of growth, your responsibilities go up. Right. You're the director of ER. ER is chaotic. You have all these things coming in and out. A lot of opportunity for errors and mistakes and problems and stress and answering to superiors. And why did this happen? So you took that on, right? Yeah. And I want to ask you, why this drive? Were you always like this as a kid, where you were driven? Why this drive for this pressure?
That I probably wouldn't have been able to answer this question 5 years ago, but I can answer it now. to me, it was about, I didn't understand what was pushing me at the time. I knew I had a purpose in life. I knew I had a mission in life. As a kid, I was always an overachiever. I was a perfectionist. I had to be the best at every sport I played. Drove my parents crazy sometimes. But, I always had that. But, it was like trying to find, what is that purpose? And when I finally stepped back, 2020, COVID, there was a lot going on. I said, what is my purpose? Why am I here? There was a reason why I didn't go to med school. There's a reason why I was, going in nursing. There's a reason why leadership comes easy to me. Like I'm able to do those things for people who, I always call them team members. They're not employees, but
it's funny. I use the same thing.
Yeah.
I just don't like the word employees.
Right.
You're a team member. And in fact, folks like, the Home Depot, Home Depot the founders never called their team members employees. They called them associates.
Yeah. It's so true to me. I treat people the way I wanted to be treated, and how I respected my, former leaders. And so that's where I learned a lot from them. But, that reflection that I did, really made me figure out my purpose. And my purpose was, I have a loud mouth. I'm not afraid to say things. I'm not afraid to, I'll be respectful, but I'm not afraid to speak up. And at that point, when I saw what we were going through as a healthcare ecosystem during COVID, I was like, we need a voice. And that's where I really started digging in. Is I think that's my purpose, and that's my drive, is to continue to have nursing represented and healthcare represented in a way where, here's the problem. We're going to bring you a solution, though, but we have to be at the table. We can't solve problems in the wings and then you expect that to happen overnight. We have to be at the table. You have to hear what we're saying. You have to understand how it impacts not only our workflow, but it could impact a patient. And when I realized that, I'm like, I'm going to be in front of every outlet I can, which drove me to want to be on the board of nursing as well, is to have a voice, have a stance, be able to look at things from a different point of view, and making sure that I'm taking in, you walk in with all of your own opinions, but now I have to sit back and understand what is the other points of view. Now let's make a very educated decision what we're going to do moving forward.
Got it. Wow. So you've mentioned, kind of being loud.
Yeah.
And you know what? I think that's important because I'm reading a book right now, and it's a book called Crucial Conversations.
Yeah.
It's an interesting book because a lot of people, when they are in front of a difficult situation, right, they can do a couple of things. Either they're just going to be quiet. So you said something to me. I'm like, you know what? She's my boss or so. I'm not going to say anything, whatever. I don't want to know. Or I'm going to say something. I'm going to speak my mind, but I'm going to speak it in a certain way that I'm going to turn you off. And it's just going to be it's going to be a conflict. And so I found in that book, and I'm not done with it yet, I'm still reading, that there's an art and that successful people know how to have crucial conversations.
Right.
So my question to you is, what are some of the points that you use to have these crucial conversations where you're passionate, but you're not offensive,
right,
and you're not intimidating?
So it changes with each circumstance, right? So it's knowing how to read the room. It's knowing how to read the situation, and then making sure you're going into the conversation. Are you there to accuse, or are you there to learn? Because there's things that happen. There's three sides to every story, right? And so are you there to learn more information about it before you come to your conclusion? For those crucial conversations with like employees or team members, those people who might report to you. But there's also crucial conversations when it comes to talking to leaders of organizations, right? And at that point, it's like, if I need to make a statement, I need to do it in a way that is valid, it's respected, and it's heard. And, making sure, like, being loud is one thing. You can be loud and obnoxious, but you can also be loud and respected. And that is really where I had to learn that skill of saying.
Interesting thing that you said you had to learn that.
Yeah.
Because I find myself also evolving in that as well. you know, a lot of these conversations, they do to a degree, especially with leaders, involve a little bit of pride, a little bit of ego, a little bit of I'm right. And I think that prevents the other team member from, in this book, they're saying to take their pool of ideas and just put it on the table. Because it's just allowing someone to put their pool of ideas on the table.
Yeah.
That's all. And then you could evaluate it. But the pride and the ego and the kind of arrogance, in essence, prevents you. You don't know, no, this is how I want it to be done.
Yeah.
That's a very difficult trait to put the volume down on.
Yeah. And
So how did you overcome that through the years in your leadership?
I learned that I will always say I'm never the smartest person in the room. I will definitely be one of those people who there are reasons why there's roles in organizations, and respecting somebody for their stance and knowing how they got there and understanding that piece, right? So it'll come back together in a minute, is when you have a situation and you have all these different roles coming to the table to try and fix it, there's not one person who has the right idea, right? And so making sure you respect that is you listen to everybody. You have to really make sure that, are we coming to a conclusion together, or are you coming to tell us what you want us to do? I ask those questions, right? Like if I'm in a room and we're trying to make a big decision and, they're like, okay, you guys work on this. And then at the very end, they're like, okay, well, we were going to do it this way anyways. Okay, well, I just wasted 8 hours of my day for that. So, it's a learned skill to make sure you understand what is the purpose of me being here. And everybody at that table has a purpose. They didn't get to the role that they're at because, they just put in an application. They were vetted. They're credible. They have the experience. They have the understanding. And so you're at this table to give your opinion. We all should listen. We should all respect that. And then having those conversations of it's okay to disagree, right? Like that's where we get every single day. It's okay to disagree, but have those disagreements in a very respectful, but constructive manner, so that there's been many times my opinion was changed by somebody who sat there and said, "But you're not seeing my side of it." And I had to learn that of like I have to walk in, take all my blinders off. Sometimes cancel out any opinion I have of something, because if we're trying to solve a problem, it's going to take everyone in that room, and it's not just one person who gets to have a say.
I think that comes with experience, and it came to me with experience. I'm going to share a story with you. When I was a young physician, I ran one of the largest house call organizations in New York, and we obviously referred patients to hospice. And one time, the patient passed away. And I didn't know about it, but they were on hospice. And so I called the family. I'm like, hey, how's Mr. Smith doing? And they're like, oh, Mr. Smith is no longer with us. You didn't know? You're like his doctor? I got livid, right? So I called the hospice organization. And at that time, the main person there was Dr. John Delphs. So shout out to Dr. Delphs. He taught me this lesson. And I go, how can you guys not even call me? How can you guys not even... My patient died. Oh, I gave him a mouthful. I'm referring patients to you. A young, hot-headed, heated guy. And he listened to me. He's like, Erik. And, he paused. He wasn't reactive to my, right? He paused there and he said, Erik, let us take a look into it. And I said, so he looks into it and he sees that they actually did call. And they did leave me a message. And it's my answering service that I had it left the digital message in the wrong mailbox that never got to me. Gotcha. So even in him calling me back, he wasn't like, young doctor, you were wrong. You went on me, but
right.
He said, Erik, I first want to thank you for bringing this up to our attention. Because of what you've mentioned, we've changed the way that we are doing XYZ. But having said that, we did call on September X at this time, and we did leave you a message. And here is the recording of the message that we left. I would suggest, just in case, check on your technical end so you're not missing.
Yeah.
I felt so bad because I went off.
Yep.
And I shouldn't have. I didn't look into, and he taught me that, that you got to calm down.
Yeah, there's a difference in reacting and responding. And you have to respond in those situations and not react. And I think that's
But it's hard when
it
you're a
is.
human being.
It is.
Because that's
and
the emotional intelligence,
correct.
right?
And I think that that's the lesson I learned. Being a young ER director, I was very passionate. I was going to make changes, and I would say, "Oh, it wasn't our fault." The same thing, right? Like it's kind of. And I had a mentor at the time. She recently passed, but she sat me down and she's like, and that's what she taught me. She's like, you can't react to everything. You have to respond. And so I'm going to teach you how to do that. And sometimes that is not saying anything right away, right? So like what he did, pause, figure out the information before you come back at something. And it is hard. My husband and I have 7 children together. So
Oh, wow. I have 6, so we can start a soccer or a basketball team.
So, you're constantly stimulated by, family and work and things, and, your fuse can get a little short. But it's understanding, for like what you said, is what did I learn from that? So in the next instance that I'm in, I will now pause and I'll respond instead of react. And so I do this with my children as well. Like, I'll tell them sometimes, like, I'm walking away from this situation for a minute because I don't want to say something that I can't take back.
Right.
And I also need to process what was just said, because there's something is broken in this process, and let's figure out what the solution is. And that's usually what it is. Something was broken in the process or the communication chain or how it works. And I think that is one thing I've always taken with me as I've learned throughout my years is learning how to be loud and respectful and learning how to respond and not react.
I love that. How do you respond and not react?
Yeah.
That's an important skill for
Yeah.
a lot of people, especially
It
the
is.
younger people who are, on the entrepreneurial journey or in a corporate journey. I mean, in the corporate world, it's even more important because you're working with certain folks, you have superiors, you have board members, and you really know how to, how to respond, not react.
I think that, I've been in rooms where a CEO has been screaming at us, and in a room where we've been talked to from a CEO standpoint, and we all were scolded. We were verbally scolded, and we thanked them for it, right? Because we're like, okay, so it's all in your
Messaging.
in your presentation, and it's not you did this. It's like, what can we do to fix it, and being part of the solution and being part of making sure you understand it. And I think that that's a really, really key point in leadership in your journey as you're going through any type of corporate or healthcare environment.
Thanks for sharing that. That's awesome. Okay, so we're going to shift gears, and I'm going to touch on 2 other things that you've mentioned. One thing that you've mentioned is about mentorship. And I know here at South Florida HIMSS, which I'm a board member of, we have a mentorship mentee program. And I remember when we were recruiting mentors and mentees, you were one of the first to say, "Hey, pick me. I want to be a mentor to somebody."
Right.
How has mentorship helped you in your life? A few examples, and how are you using that experience to pay it forward to the next generation of professionals?
I got into mentorship because, as I just mentioned, I had a mentor when I was a director of the ER, first mentor I ever had. And she was the CNO of the hospital, and she kind of took me under her wing. And at that time, I said to myself, why didn't I have this person in my life before? Why didn't I have this kind of guidance or leadership from before? And part of that was mentorship was probably not talked about as much back then. But also I was so in my zone of, being a breadwinner and providing for my family that I wasn't thinking about the bigger picture and then saying, okay, I think I need some help here. I thought I could do it all myself, right? And so that's what got me into mentorship was I had somebody guiding me and pushing me and making sure I understood some of the things that, feedback was really always giving me feedback on things. How can I improve? How well I did at something, and then giving me the opportunities to be better, so not just saying, okay, well, you messed this up, so I'm no longer going to trust you on anything. It's saying, okay, this got messed up. Here's another project. Make it successful from what you learned from that first failure. And, having that support and knowing like she's not going to, not like me anymore, not trust me. Like there's always that fear of being liked, right? And so that's what mentorship is to me, is really like guiding people and giving them opportunities that they might not have had if they didn't have your existence in their life, right? Making sure that you are giving them advice and living by it. it's different like giving advice on something, but then you're not living by it, right? So they're watching you. And so that's made me grow as a professional, as knowing like I have people who are looking to me for advice. So I am going to be on my, like on my best behavior to give
Right.
them that and
Right.
live by what I'm telling them. And it's pushed me outside of my comfort zone, right? Like, I can't sit here and say, you got to work, go outside your comfort zone and go network and go talk to people you don't know. And then I'm not doing it, right? Because then I can't give them the right advice. And so it's really pushed me to be more active in my professional growth and my own development. And that's why I really wanted to do that, and being able to just be like a sounding board for somebody, right? I think that is people who like for their HIMSS mentorship, these are clinical people with clinical backgrounds trying to break into tech. Like, me being able to tell them, okay, yeah, I hit that same hurdle, that it's just a speed bump. We're going to get through it. And so that they know they're not alone.
Yeah, it's a mentorship is just so important. It's life changing.
Yes.
It really is. And I know your mentee who you're working with is super, super blessed to have you,
thank you.
as a mentor.
I'm blessed to have him.
So another thing is about service. I've always think about in life, a lot of folks talk about, I want to get, and their whole essence. And that's why I think a lot of people may not be successful, because your whole mindset is, what can I get? I think the moment you start shifting your mindset to, how can I help? What can I give? That the world starts being a lot kinder to you.
Absolutely. Yeah.
And you are on the board of nursing it's a volunteer. Is it an appointed position?
It's a appointed position by the governor.
So the governor. Now, again, to unpack that, without going to the specifics of the board of nursing, but to unpack that for folks to understand, you have the governor of the state of Florida that appoints someone, which means they have to trust that this individual, because nursing is an important role. And you're not in this role as being on the board of nursing, you're not one-on-one with the patient. The decisions that are made affect at scale the millions of people that live in the state of Florida.
Correct.
So the decision to choose you to be on that board means it had to be very carefully vetted. And that means, I assume, that they had seen that you are there for the right reason to serve. So talk to me a little bit about your view on service, being that servant leader.
I think saying, I always want to make sure I treat people how I want to be treated, and making sure that part of that is the kind of just being transparent and honest and vulnerable with people, making sure that they understand, why am I here? Why are we having this conversation? What can I do to help you? Them knowing that they have support is really important. And that's really what guides my leadership style. I know people call it servant leader. I just say it's my style, right? Because I pull in a lot of different things of what I've seen have worked in the past, and really want to make sure that, service is one of them. And in a leadership position, you are in service to multiple different arms. You are in service towards an organization who's employed you, the people who look up to you, and then the maybe clients or patients that you're working with as well, and you're giving that service. You might be getting a paycheck, but your heart is there as service, right? And you really have to make sure, like, what am I doing to make the next wave of nurses better? What am I doing to make this organization better for our community? What am I doing to make this patient's life better so they have a better quality of life, or this family who's suffering with this? And so having that mentality has really changed how I look at problems, how I want to go about solving problems. And being on the board of nursing really started that journey of having a voice and understanding another side of nursing that I didn't understand. It's very regulatory. It's very, under like for licensing and credentialing and things like that. And it was something I didn't really understand. And we're there to protect the public. And it was a little change of thought for me of like, I've always been a huge advocate of nursing and nurses. And, now I have to make a decision on not what's best for the nursing profession sometimes, but what's best for protecting the public, which are patients that we took an oath to serve as well. And so it is, it is something that you have to make a very I guess it's a dedicated choice every single day that that's what you're going to do and not expect anything in return. Like I joined the board of nursing. I didn't like blast it everywhere, right? Like I didn't want people to think like, I was just on there for like the kudos. I was really there for a reason.
I saw that on your LinkedIn. I don't even think it's really mentioned there to that degree.
Yeah.
You have to sift very with a microscope to
Yeah.
find that there. Most people would be flaunting, hey, I'm on the, it's a position.
To me, it's because I know I'm there for the right reasons. I wasn't there for a career move for me. It wasn't there as a way for me to get recognition from anyone. I was there because I truly wanted to serve my profession and the residents of Florida. And that was part of my journey, is to understand and how do I make change and how do I grow my voice in a way that is credible and respectful, and people can look at it and say, okay, she's here to this point. How did she get here? And I don't toot my own horn, and I think that sometimes that might be my things I wish I would have done sooner. But like those are some things that it's very much what drives me every day is, am I making a difference? Even if it's in one person's life, I know I've met my goal for the day, and how did I get there?
Wow, that's really beautiful. Am I making a difference today in someone else's life? Mm-hmm. That's beautiful. Speaking of what you've mentioned, you've just touched on it as far as, look, you're in your career, you've gone through the battles of, all the different phases of moving up in the career. Looking back, if you had to, look at the camera and tell some of the next generation of folks, what would you've done a little differently? How, would you approach certain things now that you've gone through it? Like I know as a physician, what I would have done differently going into the world, so many different things now that I've learned it. In the business world, I know how I would begin with the end in mind. What are some lessons you learned?
Well, they say hindsight's 20/20, right? People ask me this question quite a bit, and I don't know if I would have changed anything, because the struggles that I had made me who I am today. I learned from them. I pivoted. I made better choices, or I made different choices. But I do think there are a few things I would go back and tell my younger self, of it's okay to ask questions. You don't have to be the smartest person in the room. And I think that was something I had to overcome, is I was like, I have all these credentials and all these degrees. Why aren't you listening to me? And it's not, it wasn't, that doesn't really matter if you can't like project what you're trying to say in a very credible or, understood way. And I think that asking questions isn't like a sign of unintelligence, right? It's that it actually is a sign of intelligence. You're wanting to know more. And if I have that question, you might have the same question, right? So I think if I could say, ask questions, advocate for yourself in a way where you can, set up kind of that path, right? Like reflect on why you're where you're at. What problem do you want to solve, right? I tell that to my children, is like, it's not what career you want to do, it's what problem do you want to solve. And then the career will come with what you want to do. And I think that if I could tell myself that, of, even working in the bedside and the ER, I was making it. I always thought I had to do more, but I was making a difference looking back. So always celebrate your wins, always celebrate your failures as well, because that's how we learn. And that's who molds you who you are today. I'm here today because I failed at a lot of things, right? But I also learned from that, and I wanted to make sure that it is okay. And let's talk about them, because that's really where the growth comes.
Yeah, you're 100% correct. As far as failures, a lot of people, they think we're conditioned in school, right? Not to fail. Right. You do bad on the test, everyone, your mom and dad are upset, your teacher's upset. So why did you fail? But through failing, you learn. And you mentioned something also important as far as focusing on the problem. There's a good book by Uri Levine, who is the co-founder of Waze, the Google apps, Google Maps kind of a thing. And he wrote a book called Focus on the Problem, Not on the Solution. I think a lot of people, they come up with solutions of, oh, this is going to be great, this. But you're right, you got to look at what is a problem for someone that I can solve. And then you go into that field solving that problem.
Right.
you don't have a solution that's only good for you or 10 other people, and then now you're making a business or a career out of that. That's important. As we're coming onto time, I want to ask you about time management, right? I mean, you're doing a whole bunch of different things. You have this overachiever. I do too. A lot of folks do. Personality. I want to be everywhere. I want to do everything right. It has to be perfect. But how do you then manage time? Because we all have 24 hours in a day. You know, I have 6 kids. You have 7 kids. So you have a family, a husband. I have a wife. So you have to give time to the fam. Because in life, there's nothing without sacrifices, right? You sacrifice one thing for the other because it's an opportunity cost. So how do you manage time? Are there any specific routines that you would suggest to people? Time blocking. What do you do?
For me, time management is really important for the reasons that you just mentioned, right? Family, work-life balance, and then making sure, can I dedicate my full self to something that I'm working on? And that's really important to me. So it is looking at the opportunities, you know, like what is being presented to you, and then kind of weighing the pros and cons. Like if I don't go to Miami and do the podcast, like what would be the con of that? What is the pro of it? The pro is I have an opportunity for my voice to be heard and talk to somebody who might be struggling, trying to break into the same field I did, you know, and the con was I just wouldn't get to be here with you. And so, but, you know, like looking at those things, right? That's how I time manage, right? Again, I think it comes down to my training as an ER nurse is like triaging. What is most important? What's going to get me to my goal? And how am I going to get there? And then really making sure, you know, if you're in a role of leadership, is making sure, am I delegating or am I just taking everything on myself?
Wow, that's so important. So triaging, and then also once you triage what needs to be done first, saying, okay, who does it? Is it something I got to do, or can I delegate it?
Right.
And I find that people who are not type A, but very like solid personalities, initially in their life, they feel like they're the ones who can only do that thing right and nobody else.
Correct.
So it's very hard to give it away.
Give it away. Yeah. But that's where that person's growth comes from, right? Like, so I also, like, I did that early in my career.
I did too.
It was one of those things where I was just like, I'll just do it myself. It's easier for me to do it myself. I used to always tell people, like, don't give me anyone to orient. They slow me down. I don't want to have time to have to like show somebody 3 or 4 times how to do something.
But you can't scale like that. You can't grow.
And, you know, I think that is where, you know, I have that piece of it now is like, you know, it might not have been done the exact way I wanted to do it, but it got us to where we got. It was a great presentation. It was a great speech. It was a great, you know, solution to the problem. Was it the exact way I would have got there? No, but it's the way they got there.
And we still got there.
And we still got there. And I didn't have to do it all myself.
And it allowed
right?
you to do what you had to do
Correct.
and focus on something else.
Yes.
As
and
well.
so, you know, accepting that and knowing like, you know, why did you put that picture there instead of that picture? It doesn't matter. Do you think does that client really care like what picture is on there? Like he chose the right, like, you know, it's like one of those things is like, I had to come to that realization of like, you know, it's not, I don't ever want to be stuck in kind of like a paralysis by overanalysis, you know, of like saying, what could you have done better? If I had done that, it would have looked like this. And, you know, it's giving them opportunities, giving them a chance to grow themselves, right? Maybe they were scared to do that. And now you just completely like deflated everything, but your team is there to support you. And if you have a good team and a good relationship with them, they will respect that and they will want to do better and they'll want to do more for you because they know that you have their back and that you want them to grow and set up that succession planning and making sure that they have the tools now. If I move on, do you have the tools to be able to do the job that you were set out to do? And so that's always like how I look at that time management piece.
It's interesting how a lot of the leaders who I talk to, they have very similar views. I just had Dr. Neva Spencer. She's the chief nursing officer of HCA Florida University Hospital, $360 million hospital with 350 employees or team members under her auspices. And that's what she said. She says one of her most beautiful feelings is when she gives someone an opportunity to grow and they grow and even they leave her department to somewhere else, but she sees that they grew because of that interaction. She's like, wow.
It is. It is such a fulfillment. I always tell people, you know, in my leadership positions is my goal is for you to surpass me.
Wow.
And if you do that, I will be the first one celebrating you because that is what my goal is. If you don't want to be in this department, where can I get you? You know, and it's having those relationships with, those who are, working with you and making sure that you can have, talk to them. It's not only about their career path, but what drives them. Some people, nobody ever asked me that until my mentor is like, well, what's driving you? And I'm like, well, the car that got me here to work today, right? Like that Corolla out there. But, it was like, but then it's just like, nobody ever asked me that. That's what really started the ball rolling with me. And, maybe somebody's never asked them that. And, they just need that kind of like push to understand like they're not alone and that they can get there.
Awesome. Well, I have to tell you, Jody, this was an incredible conversation.
Thank you.
I'm sure that a lot of people who are watching, our audience and our viewers, are going to find this very, very useful. Because, when I was growing up, we didn't really have YouTube. I don't think when you were growing up, we had YouTube, right? None of us. And, to have, or LinkedIn, and to have the opportunity to listen to people and to stand on the shoulder of giants and not to make the same mistakes, because you're hearing it over and over again, these different leadership principles, these different life principles. You're like, man, there's got to be some truth to that. Let me pivot. Let me change the way I am. Let me evolve and grow.
Right.
Oh, I wasn't the only one who felt like, commander style. People go through that. People can evolve. Wow, that's what I'm going through now. And people could watch that and learn.
Absolutely.
So talk about impact. Think about if 100, 200, 5,000 people listen to this and take something away.
Absolutely.
And then they share it with someone else, the type of impact that would have. So I thank you. I know you had a long drive.
Yeah, that's okay.
And I know you're speaking today also, correct?
am,
You're
yes.
speaking at the HIMSS HIT Women's in Healthcare Informatics, correct?
Healthcare IT.
Healthcare IT. Yeah, you're
yeah.
being featured as a speaker. So congratulations
Thank
to
you.
that. And listen, may you continue to help people, to
you.
serve in the leadership that you do and affect many, many, many lives.
Thank you. And thank you for yours as well.
Thank you very much. Nice to have
Thank
you.
you.